Hello and welcome to today's presentation on Alarm Management Mobile Learning Module. This mobile learning module consists of 3 sessions for 3 consecutive days, and today is the day 1 of this mobile learning module. Myself, Mansi Meghwal, M.Sc Nursing Batch 2022, College of Nursing, AIMS Jodhpur. To introduce, alarm fatigue is a critical issue in the intensive care unit that can lead to patient harm. And in this presentation, we will discuss the definition of alarm fatigue, categories of clinical alarm, causes of alarm fatigue, and the evidences that shows the importance of alarm management in reducing alarm fatigue. Before proceeding towards alarm fatigue, we will see some few points about alarm. An alarm is a warning that results from a measurement variance and indicates a deviation from the normal state. Historically, the word alarm originates from the Latin term ad arma, which is translated into to arms, or the French term alarme, which can be translated into to your weapons. Hence, the word indicates a call for immediate action, for attack, or for defense. In hospital, their purpose is to inform medical personnel of changes that occur in life parameters as well as of any failure of equipments. Alarms are intended to prevent patient harm by providing rapid reaction to critical situations. Alarm fatigue is a condition that occurs when a busy clinician is exposed to excessive alarm signals or frequent safety alerts, causing sensory overload. And as a result, the clinician becomes desensitized to these alarms. This desensitization can lead to longer response times or to missing important alarms, leading to fatal consequences of patient harm. Alarm fatigue is the direct result of the constant bells, bleeps, and alarm signals emitted by medical devices. Caregivers may become immune to these sounds, which increases the risk of these alarms being absorbed into the auditory landscape of hospital corridors and subsequently being ignored. In response, fatigue clinicians may turn down the alarm volume, adjust alarm settings, or turn off alarm, and these actions can have serious or fatal consequences. If we talk about the definition of alarm fatigue, as per American Association of Critical Care Nurses 2013, alarm fatigue is a sensory overload that occurs when nurses are exposed to an excessive number of alarms, which can result in desensitization to alarm sounds as well as an increased rate of missed alarms. Then we come to the categories of clinical alarms. Mainly, clinical alarms are divided into 2 types: actionable alarm, or we can see true crisis alarm, in which patient physiological condition is hampered and there is a need for immediate action. Second, non-actionable alarms. Non-actionable alarms are further divided into false alarms, which occurs when there is no danger exist, often because the medical device sensor thresholds are set too conservatively. Technical alarms, which happens when there is a medical device malfunction or failure, or a nuisance alarm. It is a true deviation from alarm limit that represents a clinically insignificant abnormality. For example, a ventilator apnea alarm activating while the patient is being intubated. In its Sentinel Event Alert, the Joint Commission identified several causes and factors that contribute to alarm fatigue. First, alarm settings that are not customized to the individual patient or patient population. Second, inadequate staffing to support or respond to alarm signals. Third, alarm conditions and settings that are not integrated with other medical devices. And fourth, equipment malfunctions and failures. Fifth, inadequate staff training on the proper use and functioning of the equipment. Example, inconsistent team training, response and interpretation of alarm signals. The Joint Commission Sentinel Event Alert April 8, 2013 data shows alarm per patient hundreds per day, alarm per unit thousands per day, and alarms per hospital 10,000s per day. Then we come to some clinical alarm statistical data. From 2005 to 2008, the US Food and Drug Administration and Manufacturer and User Facility Device Experience FDA and MODE reporting system received 566 reports of patient deaths related to monitoring device alarm. Alarm fatigue was a major contributor to these events due to the excessive number of alarms and a high percentage of false alarms. A study at a major academic medical center found a total of more than 59,000 alarms over a 12-day period, while another study found 16,953 total alarms over an 18-day period on a single medical unit. Studies have shown that the percentage of false alarms can range from 72% to 99%. Then we come to the evidences that shows the importance of alarm management in reducing alarm fatigue. The need for alarm management. In growing awareness of this issue, a number of national organizations have established alarm management guidelines and prioritized addressing alarm fatigue. Since initiating its annual list of top 10 health technology hazards in 2011, the Emergency Care Research Institute has consistently identified alarm hazard as a top issue. In 2011, the Association for the Advancement of Medical Instrumentation AAMI convened a summit with the Food and Drug Administration FDA, the Joint Commission, the American College of Clinical Engineers, and the Emergency Care Research Institute ECRI to address the issue of alarm safety and published a report outlining recommendations, challenges, and priority actions. Healthcare Technology Foundation is an organization whose aim is to promote the safe use of technologies in healthcare. In 2005, to 2006, it conducted a national online questionnaire concerning the perception of clinical alarms by medical personnel. The same study was repeated in 2011 and 2016. The later one shows best how frequent such tiresome alarms are, accompanied by an increasing number of adverse events due to clinical alarms. The number of nurses who thought that burdensome alarms are too frequent amounted to 81% in 2006, 76% in 2011, and 87% in 2016. The Joint Commission Sentinel Event Database between Jan 2009 and June 2012 shows 98 alarm-related reported events, which includes 80 resulted in deaths, 13 in permanent loss of function, and 5 in unexpected additional care or extended stay in hospital. It also shows common injuries or deaths related to alarms included from falls due to delays in treatment and ventilator use and medication errors. So, to summarize, in today's session, we discuss the history of alarm, the definition of alarm fatigue, how it occurs, what are the causes or factors which contributed to alarm fatigue, and the evidences shows that why the alarm management is needed to reduce alarm fatigue. In the next section, we will discuss how to manage clinical alarms. Thank you.